Hi, everyone. Welcome to today's webinar. I'm so glad you could join us. I'm really excited again to continue our series with the Texas Advocacy Project and have Bronwyn with us. Just a few quick announcements. If I can get my screen to do what it needs to do. Hold on. Thank you for your patience. Hi, everybody. My name is Christina Coltis, and I am the TAASA Training Director, and I'll be your host today. Everyone will be muted, but you can use the chat box at any time to ask questions. If you have a technical issue, I might be able to help with that, but I'll be responding to the chat box area. And I'm sure our speaker would love to hear your comments and questions throughout the presentation. If you're not familiar with the Texas Association Against Sexual Assault, just real quickly, we are a statewide advocacy organization, and we are really working the best that we can, everywhere we can, to eliminate sexual violence. And we do this through various endeavors, specifically through public policy, training, prevention work, and of course, supporting programs that provide services to survivors. We'd like to invite all of you to check out our annual conference. It's coming up in May. We're very excited to be in Houston this year. We have a great lineup of speakers. And if you're interested, early registration is ending this week. So you can take advantage of the bargain price of early registration. We also have another webinar scheduled next week, Helping the Helpers, How a Lawyer Can Help Your Agency, really talking about how do we keep our nonprofit organizations legally compliant and the various legal issues that organizations face sometimes. So you'll want to check that out. Please know that today's webinar is recorded, and we will post it on our YouTube channel. We're a little bit behind from the holidays, but very soon you'll be able to see our last few webinars from December posted there on our YouTube channel. You can also just go to YouTube and type in Texas Association Against Sexual Assault, and you can find our recorded webinars right there. So without further ado, I'm going to go ahead and change the presenter. You'll bear with me for just a moment.
Hello, this is Bronwyn. Can you hear me?
We can. You are live.
Great. Hi, I'm Bronwyn Blake. I'm the Chief Legal Officer at the Texas Advocacy Project, and I am not alone here today. I am joined by my good friend, coworker, and office roommate, Amanda.
Yeah. Hey, guys. It's Amanda Elkanik-Oder, Vice President of Advocacy and Outreach here at TAP. So we're so excited to share this presentation with y'all, and we really want, like any webinar or any training that we do, for this to be as interactive as possible. So we're going to be shooting y'all some messages in that chat box throughout the presentation, but also if you guys have questions, things are going on in your community, you don't know what a medical legal partnership is, we want to be able to answer those questions. So please feel free to utilize that chat box as we go along.
Well, don't ask what a medical legal partnership is, because we're going to talk about that in a minute.
Yeah, we're actually going to give you the definition.
That's like the whole thing.
So there are about 15 people on this call right now, and if you guys have never heard of Texas Advocacy Project, we want for y'all to know who we are. So we are a nonprofit law firm, and we provide free legal services very specifically to victims of intimate partner violence, sexual assault, and stalking. We are statewide, so we serve the entire state of Texas. It says down here that we have 13 attorneys on staff, but we actually now have 14 attorneys on staff, which is amazing. And all of our attorneys are able to help with civil legal services. So that's going to be like your protective orders and divorce and child custody and all of those types of things. Last year, we were able to provide 17 training sessions to Texas universities and train a ton of people. We actually provided, in the fiscal year last year, 101 trainings. So if you guys are wanting a free training in your community, if there's a topic that you guys are struggling with, we would love to be able to help you in meeting those needs. So just reach out to us so that we can help. All right, let's move on.
I think the coolest thing about Texas Advocacy Project and why I'm a longtime fan is we have no restrictions on our services. As long as you're a victim of some kind of interpersonal violence, we can help you. As you can kind of see from some of these stats, it doesn't matter what age you are, it doesn't matter where you live, it doesn't matter, I can also tell you your immigration status or even your income. And immigration status and income are frequent limitations for other free legal service providers, but not here at Texas Advocacy Project. So, you know, think of us when you have someone to refer, please.
Yeah. Okay, so let's kind of jump into, we've got an hour for this presentation, and we've got a ton of information that we want to cover with you guys. And so here's what we want to start with. We are all already serving survivors in some shape or form. So out of these 16 people who are on this webinar today, I would love for y'all to use this time as we start introducing some statistics to tell me where you work and what you do. If you're in the healthcare profession, talk to me about where you're located. I want all of that kind of fun information in our chat box, and we're going to start monitoring that here as I move on through these slides.
Yeah, I don't recognize all these names. Please introduce yourself in the chat box.
So when we look at how big is the problem, nationally, these are actually some statistics that the CDC just released the other day. So nearly 1 in 5 women and about 1 in 7 men have reported experiencing severe physical violence from an intimate partner in their lifetime. About 1 in 5 women and 1 in 12 men will have experienced contact sexual violence by an intimate partner. And then 10% of women and 2% of men reported having been stalked by an intimate partner at some point in their life. So this is a large portion of the population that we're serving. But then when we look at sexual assault as it relates to Texas and the prevalence of that here in Texas, this is kind of blurry, so I apologize for that. I can send y'all the presentation so that it's not as blurry later. But what we know is 6.3 million Texans have experienced some form of sexual violence. And when we talk about the amount of people who may have been sexually assaulted at some point in their life to the number of survivors who are actually receiving some type of medical care, we know that that number drops drastically, right? But we do know that there are reports, there are survivors who are going into hospitals who are outcrying later on in life, and we want to make sure that they understand what their legal rights are. So what is the cost of intimate partner violence? I found this statistic yesterday on CDC's website, and this is really great just to kind of understand this holistic view about how much does it actually cost for a victim. So the lifetime economic cost associated with medical services, with intimate partner violence related injuries. So there was actually a article that just came out in Fort Worth yesterday about their hospital has started a assessment tool that was actually the result of one of their patients who had come in multiple times over 3 months. She had a gash in her head, she had twisted her ankle, and every time that she would come in, she was never being screened for domestic violence or intimate partner violence. And so during this, they realized she was actually murdered by her partner weeks later, and they realized in their fatality review that they needed to include an assessment tool for all survivors, a universal screening tool. This kind of came out of that because it may be a gash on a head. She said she slipped and fell and accidentally scraped her head with a knife that she was using to chop vegetables, but we would want to ask some more questions on that, right?
Looks like we have somebody on our call from the Tarrant County MLP, part of Landwit. So yeah, if you know more about that screening tool, chime in again on the chat box.
Cool. We know that the loss of productivity from work, for survivors not being able to go to work, maybe their abusers preventing them from going to work, maybe they are having to go to court-related hearings, all of that stuff, about $3.6 trillion. That's a huge cost. And then when we look at the cost breaking it down over men and women, 103,000 and 23,000, isn't that a huge gap between the two of those, the cost of it for victims of domestic violence? Some more quick stats for y'all. There's about 10 million kids who are exposed to domestic violence. When we talk about in any like just normal dynamics training, we say when we look at domestic violence houses, about 90% of those kids are aware that their abuse is happening. The percentage of physical assaults perpetrated against women that are reported to the police annually is about 25% though. So again, there's that gap in actually the victimization versus the reporting of the victimization. We really want to talk about, and a lot of the work that we do here at Texas Advocacy Project is really trying to navigate survivors and at a high risk point in their life. So we know that a lot of survivors are at an increased risk for intimate partner violence when they're pregnant. And so this is a very dangerous time. I didn't introduce how long I've worked in this movement, all the things that I've done, because I could go on, that could be an hour-long presentation in itself. But I started this work in shelters for 6 years. So I ran domestic violence shelters and outreach centers in rural Texas and also in Houston. And during that time, it was so heartbreaking to watch women who were 8, 9 months pregnant walking down the hall. And, we used to have this kind of joke that we would, play with the survivors who were in shelter to kind of help lessen the stress of what that looked like. But I would say like, no, y'all, I was like 19 years old. I did not want any survivor giving birth in the shelter while I was on duty. So I'd be like, nope, you're going to go sit down and put your feet up, right? But this is a reality. We know that a lot of women who are pregnant are experiencing domestic violence during their pregnancy. Reproductive coercion. When we say reproductive coercion, specifically what we're talking about is when an abuser is limiting a woman's access to birth control, so contraception, maybe they're destroying birth control pills, maybe they're actually breaking condoms or removing the rings or the patches. So these are just some of the different ways that an abuser can intercede with reproductive coercion. Reproductive coercion is prevalent in about 32% of pregnant survivors of intimate partner violence. That's a pretty large number. So what does our screening look like? We're going to talk about that. Do you want to talk about this one, Bronwyn? Do you know this one? Or do you want me to?
Yeah, when we're talking about intimate partner violence, whether it be, traditional family violence or victims of sexual assault, and I see we have some representatives from other states here who are on the Coalition Against Sexual Assault in their area or the SART in their area, and welcome. This information applies both to family violence and sexual violence. So this slide is nice because it kind of explains how there are it really makes it about health outcomes for these types of abuse. I think sometimes all of us who are in the movement, we take this for granted, but when we're explaining it to other people, maybe medical professionals, for example, it helps to kind of break it down that if you're a victim of family violence or sexual violence, of course you're going to have negative health effects, but it's not just the cut on the head or the victim of rape. Some of these are going to be more subtle. Look over here on the right, irritable bowel syndrome. That can be something that is caused by stress or exacerbated by stress, and that stress might be from an incident of sexual violence or ongoing sexual violence or other type of interpersonal violence. So I like this slide, and this is a nice one to share because it's not intuitive. You wouldn't necessarily think that somebody has an eating disorder because of intimate partner violence, but we need to broaden how we think about this.
I was looking through, as Bronwyn was just talking, I was looking through the chat box to see kind of where everybody's from. So it looks like we don't even have people from Texas only, we have outside states as well, so that's super exciting.
Way to go, USA, USA.
Oh. Okay, so the impact of violence against women and the health impact of what that looks like. So we really want to look at the global of this, how many people it affects. So we know that victims are twice as likely to experience depression. They're also twice as likely to have alcohol disorder, so like abusing alcohol, abusing drugs. 16% are more likely to have a low birth weight baby. Again, when we're talking about partnering with different medical fields and different medical practices, we really want to help identify with survivors who might be experiencing domestic violence so that we can help prevent these low birth weight babies. And then you can kind of read the rest of the stats that are on here, but we just want to kind of show you what the global impact is of intimate partner violence. So, great, we've introduced intimate partner violence and sexual assault and how prevalent it is. And now the whole title of our presentation is when your gut tells you that your patient is not safe at home. And so it looks like we've got a lot of different professionals who are on this webinar today. And so I would love, what is it that you are wanting to get out of this webinar today? What is it that about our title was like you registered for it, you said, oh man, I can't wait to learn X. I want to know what that is because we want to make sure that as we go through this presentation today that we're really hitting on the needs that you have and the answers that you guys might have as well. So what is it that you're wanting to learn? What we know in going in and helping providing services to survivors, especially in a medical setting, what we see so often is that there is no assessment. There's no looking at what is happening in that victim's home, why is this victim coming in and receiving services from us, and how can we provide services in a safe way. When I spent my time at Texas Council on Family Violence on the legal policy team, I cannot tell you how many times we had medical partners, so maybe it was like the doctor had his own practice and he said, hey, listen, I want to get a law passed that it would be mandatory that any time that we see domestic violence in our clinic, we're a mandatory reporter. And that is really harmful for survivors. And the reason why that's harmful is because we want for the choice and the power of when and how to report to be in the hands of survivors as much as possible. And we could potentially be placing them at a higher risk if we take that power out of their hands. Now, there are certain situations. If somebody's been shot, obviously you're going to have to report. If there's been child abuse, obviously somebody's going to have to report to law enforcement. But outside of that, we really want to keep the power in the survivor's hands.
But just because medical professionals are not mandatory reporters, it doesn't mean that we don't want them to learn and discover this intimate partner violence in their patients, because it's exactly the opposite. And Amanda will talk about why it's so important for us to involve more medical professionals in this idea of spotting it. When you're at that special time where you have confidentiality and you might be alone and you're taking care of yourself, there's a big opportunity there that we want to take advantage of. I see we have a SANE program coordinator on the call. That's awesome. Please answer Amanda's question about what's the number one thing you're hoping to get out of this presentation. Great.
So we want for some risk assessment, some safety planning to be a part of this. But as we're looking through this, we really want, one of the questions that we come up with often is, well, why don't survivors ever leave? And what we know is that a survivor on average is going to leave and return about 6 times before they actually leave for good. We're going to talk about some statistics later on in this presentation that when survivors have the support of healthcare professionals, that average actually goes down. So we really want to make sure that our healthcare professionals and our advocates are working together to be able to create safety plans and resources for survivors to be able to access systems. So why might it be hard for victims to leave? Why might they come into your practice, or why might a victim go into the doctor's office but then never but then go home to their abuser right afterwards? Well, there's a lot of reasoning behind that. So the decision to leave can mean a lot of different things. It can mean an increase in the partner in the violence that's happening. It can be an increased risk for their children. It could mean that they lose their house. They're going to lose their income, their job, their health insurance, their immigration status. even just their family and friends in general. So we know that this is a huge risk that survivors are going to take when they do decide to leave. We want to make sure that they have all of the support around them so that they are successful in being able to break the cycle of violence. So the first question I want to ask you is, how are you screening? If you are in the medical field, what does that screening process look like? We work with a couple of different healthcare practices here in the Austin area, and we've been able to see and integrate into their screening tools. But I'd love to be able to, for you to use this chat box to say, are you screening? You might not even be screening. You may just be anecdotally, you might ask if you see somebody who has bruises or might have marks on them that would raise red flags for you, but what happens if that's not you in the room?
And those of you on the call who aren't in the medical field, maybe you're in the movement, I want you all to be involved in checking on the screenings that are being done at medical service providers in your area. So this next slide, this is Bronwyn again, Chief Legal Officer, Texas Advocacy Project. I just want to drop some knowledge on y'all. This is part of our Texas Family Code that medical service providers all over our state, and those of you from other states may have similar laws. I'm happy to connect you with service providers in your area. But here in Texas, our doctors and other medical service providers have to provide a required notification with these certain components. It has to be in English and Spanish. It has to provide the local resources. So some of you all might be that local resource. One thing that we can give you from Texas Advocacy Project is we have made these really cute, almost laminated cards that you can share with your local medical service providers. And they have all of this information on them. So wouldn't that be convenient for the doctors and nurses that you might have contact with to be able to hand this card out? We've put our contact information on it. And those of y'all that are in the movement, you could add your contact information to the bottom. So, know that this is a law and use it as leverage in your area. And we'd like to help you with that by giving you some of those cards. Just reach out to us at the end. There's actually, this continues on the second page. This is like the quote unquote, what substantively needs to be on that card and or in that warning, and our cards meet the basic requirements of the law.
Yeah. So what this kind of looks like, to kind of break this down for you, is you might not even have like a screening tool in place, but you may see somebody in your clinic, or you may train your medical professionals to see somebody who's in their clinic that might raise some red flags, and you could give them this card in a very discreet way. It's very small, so then it doesn't raise any red flags in case their abuser is in the room with them or might be going home with them later on that afternoon, to be able to let them know what their rights are and different services that are available to them. So there are a ton. When I say a ton, I mean a ton of different assessment tools specifically for people working in a healthcare setting. And so I've done like a lot of research on what the different assessment tools are, and I have an entire presentation on that. But they do mention like the danger assessment, which a lot of us in this movement are very familiar with, but there are also actually some better tools than even just that danger assessment that have been studied scientifically, that are able to provide a lot of really great data for us to understand how to serve survivors better. So this is that resource where you can go and do some homework afterwards, if you're in a healthcare setting, to see what the different options are that you could copy and paste into your own screening tools, but also then what other areas, what other countries are even using as well. Okay, I want to scroll up and see what questions we had that were asked really quickly. It's so small up there.
I think that's
okay,
the first
just one.
question.
Did you read it? We struggle with placement and resources when we don't have
an advocate available and the victim is ready to leave. Yeah.
Where are you from?
Scroll up.
Sorry, I'm scrolling up.
It's Andrew Presley, so keep scrolling up.
Hold on. Let me see if she. Yeah.
I can let me talk the next.
Yeah, I'll let you talk.
Okay, guys, while Amanda's looking through
Houston.
your questions, I want to start by answering a real big question. Amanda talked to you about a big problem. You guys already kind of knew that was a problem. And we've talked to you about step one, which is screening and identifying this huge problem among people that might be seeking medical attention. But what is the point of something called a medical legal partnership? I want to talk about it. And our caller who is on from the Tarrant County MLP, you feel free to chime in if I'm leaving something out. But what's great about a medical legal partnership, it's a way to involve, two big communities of service providers and connect them. And the nexus, the connection between these is identifying that the idea that there are social determinants of health. And here in the US, our CDC is really good about understanding this, and they've always looked at intimate partner violence as a medical issue. So that's really helpful for us, and I think the medical community understands that. They know that if someone's been raped or if somebody comes in with that cut on their forehead, hey, we need to talk to them about domestic violence or sexual assault. But there are other issues they need to be looking for. They really need to be looking and understanding how much income and access to benefits can affect someone's health. Mm-hmm. How much access to stable housing? What about the risk of eviction? How would that affect someone's health? Look at other things on here. If somebody's struggling with stable employment, if they don't have, a documented immigration status, how is that going to affect their health? And then, of course, what if they have some instability in their family, maybe connected to that interpersonal violence? So we know that 60% of someone's health is determined by these social factors. That's a big deal. So what a medical legal partnership can do is it can integrate legal solutions to some of those social issues as a component of the patient's overall care. Integral care is a big trend across our country now. We have different medical service providers working more closely together, but a lawyer can also be part of that team. And once we get that basic concept across, hey, don't just call the psychologist and the social worker and the radiologist. Let's also call the lawyer. That's the big step. Once we get that across, now we're really cooking, and that's when we can move forward with these medical legal partnerships. So let's talk about the easiest form of medical legal partnerships, and I'm going to start saying MLP instead so we can speed this up. But the most basic form of an MLP is a referral, and a strong referral network can count. I'd love to go further than that, but let's start here. So if the medical service provider, they see someone, they think like, oh, they've got irritable bowel syndrome, it's from stress. What's that stress from? I did a screening, and now I know that they're not safe. They've been a victim of sexual violence, or they've been a victim of interpersonal violence. Can a lawyer help with this? How can a lawyer help? They don't need to be the ones to figure that out. We want everyone working at the top of their own license. Let the lawyers do the lawyer job, and the doctors and nurses and medical service providers do the medical care. But just referring to a lawyer can do the screening like we do here at Texas Advocacy Project, and like our caller from the Tarrant County MLP. Sorry to keep putting you on the spot. I'm sure you all do. We do a screening of our own. We don't ask, does your mom have diabetes? We ask different questions to figure out what all are the legal issues here. We might even discover legal issues that they weren't initially coming in for, and then trying to find them some solutions for that. So that's the most basic form of MLP, but ideally, what we would really want to have happen is a fully integrated MLP. And this one's a little harder. This is where you might picture, okay, if you're at a hospital, you might go down the hall for that x-ray. What if you could go down the hall and see the lawyer? Get it all done, one-stop shop. Or at least have an appointment where you could come back to that familiar setting, that safe setting. Maybe, if it's an abuser that knows you, a setting that they wouldn't get suspicious of, and you could talk to the lawyer there. Maybe the lawyer's there in person, or maybe they can video conference with you from that safe location. You know, at Texas Advocacy Project, we're exploring all different kinds of solutions here, but having the lawyer in-house has been proven to be the most effective way to fully integrate that MLP, because the doctors and nurses and medical service providers start to recognize that this is a resource. It's in their face. They see that human being, and they understand that's somebody that can take that referrals and be a resource to them as well. So we'd really love that to happen. And sometimes it takes some convincing. So we have lots of slides to try to help convince people. So I know some of y'all are, we have a SANE program coordinator on the call. We have somebody from ASART. You are active members of your community, and you could be a part of making this argument. Like, you could be a part of calling Texas Advocacy Project in or someone else in and trying to make this happen. It's going to help victims. It will also help patients. We call them patient clients a lot of times. But if you get this legal service, you are going to be less likely to be hospitalized. You're more likely to take your medication. The clinic is more likely to be reimbursed from payers. These are arguments that are going to appeal to that medical service provider. And there's other benefits as well. If you go to the next slide, please, Amanda. Thank you. So we also know that 86% of people who visited a medical legal partnership had improved outcomes. You know, these are huge numbers. And it's not always an intuitive. Remember, it's not just the rape victim. It's not, or the person who came in because of a rape. It's not just the person who came in because of a cut on their head. We have to look at those more subtle things, and you're not going to know it unless you're doing the screening that Amanda talked about. So all of this kind of goes together, and how it can best go together leads us into the next part of our presentation, which is best practices for these MLPs. Please do chime in if you guys are working with an MLP and can comment on this. But the World Health Organization, not just our own CDC here in the United States, but the World Health Organization wants people to recognize abuse in their clinics. They want to make sure providers are trained to do that recognition, that they have screening tools like Amanda talked about, that confidentiality is guaranteed, because we know that really encourages candor and can improve rapport between the medical provider and the patient client. Thank you. So health providers are a key part of this team because they're the first line response. They're the only ones who are going to see that victim sometimes. They can do the screening. They can help connect them with comprehensive care, including legal care. They can be a nexus for us to provide those trainings. And they can really integrate this into their existing health services. There's just so many reasons why we need them on board for this. All these different reasons, but also safety planning.
When we think about working with healthcare professionals from like 10 or 15 years ago, or even 20 years ago in some other areas, what we know is that we wanted this partnership. We wanted this relationship as advocates in this work for a long time. We know that the more people that we have that come around the table and are able to provide coordinated community care, the more likely that survivors are to exit those relationships and do so safely, right? And so just the recognition and validation of a survivor's experience is a critical first step in safety planning. And so the way in doing this is using that assessment tool, having universal assessment. The state of California has their own health general, what is it called? Like whenever you, Surgeon General, thank you. They have their own Surgeon General. She's amazing. And she's actually mandated a universal screening tool for abuse of all different types of abuse for every single healthcare setting. And so when we are able to recognize that, then you're going to be providing more training in your communities to those healthcare providers. They're going to feel like they are able to recognize better, that they are able to validate a survivor's experience better. And when survivors in general, not just women, but survivors in general who feel comfortable and safe and trusted by their healthcare professionals, they're 2.6 times more likely to exit that abusive relationship. That's huge. That's validating for both the survivor and feeling safe enough in that room to be able to tell the most horrible details of their life at times in a time of crisis, but then for that to be followed up with real action. For them to have an attorney who can say, oh no, all of those things that your abuser told you would never get, that you don't have access to, that if you leave that I'm going to take away from you, when you have an attorney on the other end right away saying, oh no, here are actually what your legal rights are, that is so powerful.
So having healthcare professionals on the front lines doing safety planning, making a survivor 2.6% or 2.6 times more likely to exit and be safe, as if that wasn't enough, there is even more we can do as part of these medical legal partnerships. So let's click through and kind of add some things up to this board, because what might these health harming legal needs look like in the healthcare practice? What solutions could a legal service provider like, I don't know, Texas Advocacy Project provide? So we've been talking about safety and safety planning. This is the most basic presentation that a healthcare provider is going to see. Maybe this is a victim of sexual assault who's come in, they're getting a SANE exam, they need to access safety, refer them over to Texas Advocacy Project. We could talk to them about a lot of options for their safety, getting a protective order. That's great, but there is so much more that we can do for a survivor. We want to meet them where they are. We want to find out what justice means to them. So let me just give you just a few other examples. This is not a comprehensive list. We could think of many more examples, but I just want to kind of spark your imagination here. Let's talk about privacy. When we ask victims of sexual violence, what are the things they most care about? It's their safety and privacy. So these are the top two here. So number two, privacy. Let's say that we have a teen, maybe they've shared a nude photo with somebody, and now they're feeling suicidal, and they're seeing a healthcare provider because of that. Well, if they're referred to Texas Advocacy Project, we can help them get an injunction to prevent that revenge pornography, prevent it from being shared, and really kind of solve that problem from a legal angle while they also get treated for their mental health issues. What about employment? Let's say that there's a victim of sexual harassment who ends up getting fired and they're losing their health insurance because of that. Call Texas Advocacy Project and we can help them get that health insurance coverage back. Let's talk about family law. Maybe there's a victim of rape who's become pregnant because of that sexual assault, and they're concerned the rapist is going to have access to the child that they're bearing. Call Texas Advocacy Project. We can terminate the rapist's rights to that child and prevent that from happening. What about criminal justice? Let's say there's a victim of sexual violence and their parent is taking them to the doctor, taking them all around, and having to miss work to do that. Call Texas Advocacy Project. We can help the parent apply for crime victims compensation to help them recoup those lost wages. What about an educational issue? Let's say there's a minor patient who's exhibiting some of the effects of bullying at school. A medical service provider is trained to spot these. It could be weight loss, weight gain, things like that. So maybe they're seeing a healthcare provider for that. But if they call Texas Advocacy Project as well, we could help them access a school stay-away agreement or get them other accommodations at their educational institution to help them feel safe. That can help solve the health issue as well. These things are all interconnected. I have just a couple more examples I want to share with you. Let's talk about a financial example. What if you have a non-custodial parent? That's somebody that the children don't live with them primarily. So that other parent, maybe they're not paying their half of uninsured healthcare expenses. This can prevent that primary parent from accessing healthcare for the child. Call Texas Advocacy Project. We can go to court and garnish the wages of that non-custodial parent to make sure that those uninsured healthcare expenses are covered and that child can get the treatment they need for whatever it is. So maybe the patient themselves isn't the victim. That's a nice example where, the adults involved are the ones experiencing that interpersonal violence and that emotional abuse, financial abuse, all different kinds. Mm-hmm. Let's talk about civil legal liability. Maybe the victim, who's a patient, might have a personal injury claim against their abuser. If they were assaulted, sexually assaulted, and this is somebody that you could recoup funds from, call Texas Advocacy Project. We can help connect them with who they need to have a lawsuit and get compensation for their injuries, their medical expenses, and sometimes in Texas, even emotional distress that's connected to that. So all of these are ways that Texas Advocacy Project can help someone. And we issue SPOT in every case for every single one of these. It's not the responsibility of the healthcare provider to know all this or spot all of this. I don't tell all of you these examples because I want you to be the one screening for them. I just want medical providers who have a suspicion and might believe that there's something more going on there to use those screening tools that Amanda talked about and refer to Texas Advocacy Project. Hopefully that referral chain can lead to a fully integrated MLP. But either way, we want to screen patient clients for eligibility for our services and screen them for these issues.
So this slide is really just kind of reiterating exactly what Bronwyn just went over on how having access to civil legal services, having quick access to civil legal services can help improve health and wellness for survivors. And just to recap on a few of those ways, having the ability to have access to free legal assistance is going to reduce a survivor's stress tremendously. We know this in any case that we're working. Just being able to speak with a survivor, maybe that survivor is not ready to leave the violence, just being able to speak with an attorney to understand what their legal rights are is so powerful and can help reduce their stress. Remember what we talked about at the beginning of this presentation, all of those health effects that are caused by stress, right? I bet there's a million different podcasts on it that we could all go listen to. Divorce, we're able to provide closure, we're able to provide financial support. In the protective orders, we're able to provide safety for survivors. In safety planning, we're able to reduce that risk of injury. We know that intimate partner violence, we know that sexual assault is a public health issue. We know that civil legal services, when they are linked with medical services, are able to provide the most holistic and life-saving resources to survivors, and we want to be able to help do that.
I think that's a great way to bottom line it. And I really want to connect. We have 20 people on this webinar now, and we would love to connect with each and every one of you. I saw that some of you all are in the university setting. Yeah. We would love to come out and give trainings at that university. That's definitely something we're focusing on last year and this year. We're continuing to do that. I saw that some of you are involved in the sexual assault nurse examiner program. We'd love to give you some of these cards to help you meet that legal obligation under the Texas Family Code. Those of you at a SART, do you have medical professionals on your SART? Do you have legal professionals on your SART? Can Texas Advocacy Project be a part of that? Can we be a part of making that connection stronger? Those of y'all who are in the movement, join us. Let's make some MLPs in your area. You can be that nexus, that point of connection between your local healthcare provider and Texas Advocacy Project. And my partner here, who's already from an existing MLP, share your knowledge. Anything that we could do at Texas Advocacy Project, maybe we could take referrals from you. If you get to capacity, if you have somebody that maybe doesn't have that immigration status that allows you to help them, or doesn't have that low income on paper that allows you to help them, you can send them over to us. Because remember, Texas Advocacy Project has no limitation on our services. So we're leaving our phone number up there. I'd love for y'all to memorize it. 1-800-374-HOPE. Super easy to memorize. Please send those referrals. But remember, referral streams are the most basic form of MLP. Our secret goal is to get that more integrated form, and you guys can be the people that make that happen. I hope some of y'all are getting that passion sparked in you that Amanda and I have, or maybe you already are bringing that to the table. And when passionate people get together, anything can happen.
So we want to leave the last 15 minutes open to y'all. What are the questions that you guys wanted to know? What are the questions that you guys have? We want to be a resource. We want to be able to help answer those questions. I'm going to give y'all a couple minutes to be able to type those questions in the chat box.
So the question that we've gotten so far comes from the Katy, Texas area, the Houston, Texas area, and this is from our SANE program coordinator who's having some trouble accessing placement or resources when there's not an advocate available for a victim who's ready to leave. So what's great about Katy and Houston is you have those people in the movement through Katy Christian Ministries and the Houston Area Women's Center and your rape crisis centers who do want to help connect you with services. Maybe we're talking about a shelter service or something like that. But for legal services, you know, in that area, you're looking at Lone Star Legal Aid, or hey, please call Texas Advocacy Project. We want to get those referrals. We don't have the limitations on our services that sometimes Lone Star Legal Aid might have. So any of those victims who are connecting with the SANE, they qualify for our services, I can guarantee it. So call Texas Advocacy Project, have that number ready, have a stack of those cards ready to hand out. And let's go ahead and try to integrate an MLP a little bit more. So thank you for that first question. But if anybody else has a question, please chime in. We've got a couple of people from our sister state over there in Mississippi. If you're noticing some different things in your state, we'd love to hear from you as well. This is definitely something that's being implemented to varying degrees across the country. You know, we definitely, as always, looking at California for leading the way in a lot of ways. But, you know, here in the South, in Texas and Mississippi, we can lead the way too.
Okay. I guess y'all don't have any questions for right now. If you guys think of questions that you guys have after we get done with our presentation today, then feel free to reach out to either Bronwyn or I. We'd love to be able to help y'all.
I think we'd like to end with just giving a big thank you to the Texas Association Against Sexual Assault, really leading the way for our entire state in providing services for victims of sexual violence. And really making sure they're not second-class citizens in the movement, which can happen. Here at Texas Advocacy Project, we are really focusing on service providers for service for victims of sexual violence, not just intimate partner violence.
So the question is, what is the difference between Texas Advocacy Project and LASA?
Ooh, it looks like we have a question. Thank you for chiming in. So Texas Advocacy Project, we are a nonprofit law firm, like you may have heard of TAASA, Texas Rio Grande Legal Aid, or Lone Star Legal Aid, or we have a caller even from Landwin, Legal Aid of Northwest Texas. So we're all nonprofit law firms serving people. LASA stands for Legal Access for Survivors of Sexual Assault, and this is a special program here in Texas that we've had for the last few years now. It's a funding stream. It kind of, I mean, I could go on about where the funding comes from, but it started out as $10 million to provide legal services for victims of sexual violence. This was a groundbreaking watershed moment in our state. Traditionally, funds for interpersonal violence were swallowed up by people providing services for victims of domestic violence. So those divorces, things like that, custody cases. That's very important and that's great, but it left a lot of victims of sexual violence out of the loop. It's harder to spot that type of violence sometimes. It's harder to access those victims. So what's so great about the loss of funding is it really gave us a moment to pause and concentrate on what are the unique legal needs of victims of sexual violence and how can we as legal service providers help. So there are 8 different partners who are receiving lots of funds. Texas Advocacy Project is one of those 8. Landwid, Lone Star, and Trala are also partners in the LASA network. All of us are really using those funds to concentrate on being better legal service providers. And what I think is the most badass part about it is it's creating a new specialty in the legal profession. You can say, I am a lawyer for victims of sexual assault, and that is not something that existed in our state 3 years ago. So it's really cool, and Texas Advocacy Project is super proud to be a LASA partner.
Yes, TLSC is also, Texas Legal Services Center is also one of the partners.
Yes, there are 8 partners, and just a few of us are statewide. So Texas Legal Services Center is one of the only statewide partners. The other ones are regional. Texas Advocacy Project is the other statewide partner. So, we're best buddies with TLSC, and TLSC is also a leader in the medical legal partnership community. So if you want to learn more about their MLP work, please go to the TLSC website and you can learn from them as well.
Okay.
Okay, it looks like we've answered those questions. So unless I see another one, I think we might give you 8 minutes of your life back. I know we all love that.
Awesome. Thank you guys
so much for this presentation today. And thank you all for joining us today for the webinar. Like I said, this is recorded and will be available on our YouTube channel. You'll also, about an hour after the presentation is over, receive an automated email with an evaluation link, or you'll receive an evaluation pop-up. We'd love to have your feedback. We share it with our presenters, as well as hopefully help us identify future webinars and things that we can improve on. So please take a moment when you receive that to do that evaluation. It really helps. Thank you so much. Have a great afternoon.
Thank you.
Bye.
Bye.